Hello, welcome to the morning show with me, Martin King.
And with me, Sybil Mulcahy. Coming up today, since she was a child, Yvette Byrne has struggled with everyday life. Prescribed antidepressants by her doctor, she knew there was something more. Then last year, she was diagnosed with borderline personality disorder.
A lot of people would say, well, you're so happy all the time, but the smile is actually the fight you're putting on just to try say, like, I want to be happy and I'm not going to let this beat me, but it's every day.
Yvette will be telling us why she hopes speaking out will help others going through the same thing.
Also, do you have chronic pain? Psychologist Alison Keating will have advice on managing the psychological aspects of the condition as well as the physical.
Plus, the future is most definitely in safe hands. Martin paid a visit to the Young Social Innovators Showcase recently to hear all about their great ideas.
People said they felt safer at home than anywhere else, so we decided to do it in road safety, and that if you feel safe at home, you should feel safe in a car. So we got inside of the car and we stripped everything out and put in a sitting room.
And despite the sunshine and great lifestyle, Australia just didn't cut it for Claire Cullen. She missed Ireland too much, so she arrived home without telling anyone.
Where's my dry hand spicy?
Later we'll be chatting to the returned emigrant. But first today, since a young age, Yvette Byrne has always felt highly emotional and struggled to cope with day-to-day life. This eventually manifested itself in self-harming.
Prescribed antidepressants by the doctor, she felt there was something more to how she was feeling. Then last year, she was diagnosed with borderline personality disorder.
It took a long time to get to the final diagnosis because just from going to GPs and just trying to find out what would help the best and medication and what was really wrong. So it did take a good few months between coming home, telling my parents I wasn't feeling well, to being hospitalised, to finding out I had my diagnosis and then getting help with it. And here I am a year later, still getting help. So having borderline personality disorder, it's very confusing, and people, especially professionals, kind of look at you as in saying, this confuses us just as it confuses you, and I think it's a lot of confusion about it, so there's a lot of work in yourself and with professionals. So I think actually the diagnosis was a relief at the start, but afterwards I found out how complicated it is, and you really have to learn to live with it and work with it, and I found that quite hard, but now I'm finding it easier. Parents, I think, don't know, and they might think their teenagers are just going through a difficult time, but really I think if you're really looking for it or you're aware of it, the telltale signs are there, and if you catch it in your early teens, it does make life after that a lot easier.
And Yvette joins us now together with Dr. Richard Blennerhassett, a Clinical Director at John of God Hospital in Dublin. You're both very welcome to the programme, and thank you for coming in. Yvette, you wrote to us asking us to discuss this. I suppose at that stage you didn't realise that it was going to be you
No, exactly, yeah.
Because it is very brave of you to be here, because people haven't spoken out about it before.
Yeah, thank you. Yeah, I feel like it does need to be spoken about, and it's about time somebody did, because I feel like when one person speaks about it, a lot of people are able to feel more open to coming forward about it then as well. So
tell us how you feel when you know an anxious moment might arise or a stressful moment might occur.
Well, I guess for everybody goes through stages of feeling a bit down or a bit anxious or just different emotions, but with having an emotional disorder, it's on such an intensity that it really affects your life in a big way, and you really have to just kind of, you don't really know how to react or how to do anything to...
Like something as simple as a school child in the yard, somebody might say they didn't want to play with you.
Yeah, I guess, yeah, but that's a really good example actually, because it's like for anybody else to just say, oh yeah, that's fine and gone, but I would really have taken it to heart, and then it would just go over and over in my head, and I'd constantly think about it and think of every reason why they didn't want to play with me, and then I just would have myself feeling so upset over it, but the emotion would just be so intense that it would just be so hard to cope with even as a child. So I always felt like I was always so sad and upset over things, and I was a child that other children wouldn't be upset over.
Mm-hmm. It started at 14, was that for you? And do you remember what those first feelings were?
Yeah, I really feel like it started for me as a child, but when I hit 14, teenage years, it really did kind of manifest from there, because I guess being a teenager and all the traumas that comes with that, I just felt it just got so much worse in secondary school, and just dealing with stresses of exams, and I just felt like it went on a whole different level of not being able to cope with daily life, and just being constantly over emotional all the time.
Like crying and unhappy?
Yeah, just unhappy in myself, and I'd always cover it up with a smile, but not that I was always sad, but I just felt like I'm gonna have to smile now, or people will just think, oh, what's wrong? And you can't explain what's wrong, so you just say, oh, it's just easier to smile. So that's what I've pretty much felt like, anxious and sad, but put a happiness on top of it, and just every emotion mixed together, then I'd feel, and by the end of the day it would just be, I don't know how I feel. It was just so exhausting all the time.
Well, yeah, it's impossible to explain to somebody how you feel when you don't know it yourself.
Exactly, that was probably the most distressing, and it was probably because I never said to my parents or said to anyone, because then, what's wrong with you? I don't know, I'm upset or I'm sad.
When did you start self-harm?
Self-harm for me started at probably 14 or 15. It just became a way of being able to cope, and it's just like a way of coping that actually worked.
Can you explain when you say it's a way to cope?
Yeah, I guess for people that don't understand self-harming, and it's obviously there's a taboo attached to it, is that self-harming is obviously like nobody wants to really talk about it, but I feel like for young people, self-harm, it's actually a way of releasing just the emotional trauma and emotional pain you feel, and it's by releasing it in a physical way. And I guess for someone who doesn't understand, for example, people who don't have emotional problems, if they even imagine how upset and depressed and sad you'd have to feel before you'd even consider doing an action such as self-harming, and then imagine how low you'd actually have to feel to actually self-harm, it would be extremely low. So maybe that you could understand then how low.
So this was a release for you?
Yeah, it was a release, yeah.
Because people have this misconception that people who self-harm are doing it for attention.
There is no such way why you'd ever want attention in that way, not at all. It's literally a way of actually coping with emotions that you can't control, and it's a way of releasing them. And then sometimes if you're going through a bad patch with the disorder, self-harming is actually a way of bringing you back to reality, because you just feel so lost inside yourself. So it's a coping mechanism, and no one, obviously people don't want to do it, but it's just a coping mechanism, and it's obviously a bad way, but a lot of people use it.
Yeah.
So.
Dr. Blennerhassett, we bring in here, it typically affects young women, does it? Borderline personality disorder?
Yes, it is commoner in women and men, and like in Yvette's experience, often comes on in the teenage years, where there's a tremendous sensitivity to emotions, and people with this condition, you could say, are very hypersensitive emotionally, and it often gets expressed in quite dramatic fashions with very marked irritability, anger, alongside depression. And like again with Yvette, they look at ways to cope with this, and strangely enough, self-harming is one of the things they discover can help. And it may seem strange to the rest of us, but this seems, in a person with this condition, it seems to help to regulate their emotional disturbance. And perhaps what's happening here at the level of the brain, that the emotional circuits are in overdrive, and the other areas of the brain that perhaps help to dampen down, to cool down our emotions, aren't working so well. So you get all of these very strange behaviors happening. Impulsivity, the kind of not being able to perhaps pause before you embark on things is very typical, and this can, in some people, and maybe at later stages, give rise to problems with addictions, alcohol problems and such like. Sometimes too, sufferers often get into very chaotic relationships, because an aspect that people may experience is a sense of perhaps inner loneliness, inner alienation, a little sense of their own identity. So they often look to other people to help them in their lives and want to get very close to them, and then get tremendously upset if the other person seeks to leave them, and all kinds of chaos ensues. So it tends to be a very stormy condition.
And needs treatment, because of it.
Absolutely.
You got very, very low last year, and you ended up in St. Pat's, and that helped, didn't it?
Yeah, I really felt like when I finally came home and explained to my parents that I wasn't feeling well, I felt like it was kind of a long trek between then and being hospitalised, as in trying to work out how serious it was and what was wrong. But when I went into hospital and I got a diagnosis, I really felt like I was going to get help, and it just was such a relief, because I just feel like I would waited so long to just kind of find out what was finally wrong with me. And just,
I know your parents, you said your father couldn't believe it, like they had no idea.
No, they had no idea, and they were just so shocked, because my core personality would be quite a happy, outgoing one, and I think that's why people found it so hard to believe that I could have something that was something like this, because I was always so happy. And even my friends would say, like, you're always so happy. But I am happy, but it's just the condition just dampens it down all the time.
Talking is the therapy, isn't it, for borderline?
Yes,
it's not medication, really.
Well,
is it?
Medication can play a role, but I would say that psychological approaches are the best in this condition. And perhaps the most helpful has been, or one that certainly got a lot of attention and has helped many people, is an approach called dialectical behaviour therapy, introduced by Marcia Linehan, an American psychologist. She introduced this approach around 1990, and the whole aim of it is to try and help stabilize those very disturbed emotional states, helping people to perhaps pause before they act. And in doing that, she teaches people various skills, which Yvette, I think, may have been learning in recent times.
And you're coming along great now, Yvette, aren't you?
Yeah, I really feel like I'm doing, like, it's been a year since I've been in hospital, and I do feel like I'm doing much better now. I mean, it does take a long time to kind of come around from being so low, but when you're starting to feel better each day, it does make it a lot easier. So.
You're pursuing your career again. Your studies had to take a backseat for a little while.
Yeah, I studied fashion design, and I know it's what I love and it's what I want to do, but I really just had to honestly just revert to what it was like to be a child, move home and just do the simple things in life again and just take everything easy for a while. But I feel like I'm building myself back up again, and I feel like I'm getting stronger, and I know I want my career to go on, and so I'm not going to let it stop me. It's just stopped me for now, really. So
yeah, it's just a slight pause.
Yeah, exactly. Yeah.
The problem is, though, of course, initially when you went to the GP, medication was being prescribed, and that's a mistake that you say an awful lot of medical people are making.
Yeah, I really feel like when I went to my doctor when I was feeling very low this time last year, and I said that I was feeling low, and I feel like he just had a prescription written out for me for antidepressants and said that this is what he felt like was for me. But I really felt like talking therapy would have helped. When I asked for that, I was told I was going to be on a waiting list with a psychiatrist for 2 months, and I really felt like in such a desperate state that I needed more help than that. So, and now when I've got my diagnosis, I found out that medication can't actually do anything for it. It can only do something for the side conditions you have, such as anxiety and depression.
Okay. For anybody who's watching today, who may have the same feelings that you have had, what do you say to them?
Definitely the first and hardest step that I found was coming home and asking for help, because no one wants to ask for help with that kind of, no one wants to say like, well, I feel depressed or I feel down. But once you get the help, it really does make life easier. And I wish I asked for help 10 years ago, because it really does, like, having the support and people who understand your condition around you just makes your life so much easier, and people just take a different approach to you. So definitely ask for help. It's my number one thing.
Well, thank you for coming in to talk to us today. And Dr. Blanner Hassett, thank you as well.
Thank you very much.
Thank you.